This update matters because it directly affects how money reaches seniors, retirees, and people living on fixed incomes throughout the United States. Federal officials are actively revising major elements of the national relief strategy, and those revisions are changing the way stimulus support, pension safeguards, and benefit adjustments are handled. These are not abstract policy tweaks. They shape how monthly budgets hold together, how groceries are paid for, how rent and utility bills are covered, and how medical costs are managed. For many older Americans, these changes influence not just finances, but peace of mind and daily stability. This explanation lays out what has shifted, what is still being adjusted, and how support is expected to move going forward. Over recent months, pressure has mounted on policymakers to respond more effectively to the cost burdens facing seniors. While inflation figures may suggest slowing trends, the reality at the household level looks very different. Housing costs remain elevated, healthcare expenses continue to rise, utility bills fluctuate unpredictably, and food prices strain already tight budgets. Fixed incomes do not expand when costs climb, and this gap between income and expenses has become impossible to ignore. Federal agencies have openly recognized that earlier relief approaches did not fully reflect the prolonged nature of these pressures on retirees, disability beneficiaries, veterans, and Social Security recipients. That recognition has led to structural changes rather than another one-time payment approach. The revised relief framework is being designed as a layered system that works alongside existing benefits instead of sitting apart from them. Social Security, supplemental security income, Social Security disability insurance, and veterans benefits are now being reviewed together. The intention is to reduce gaps where some seniors previously qualified for help, while others with similar needs were excluded due to technical eligibility lines. Those gaps caused confusion and hardship, and correcting them has become a central focus of the new strategy. One of the most meaningful shifts involves how eligibility is determined. Instead of relying almost entirely on past tax filings, agencies are giving more weight to current benefit status and ongoing household costs. Seniors who rely primarily on Social Security are now being viewed through a different lens than working-age households. This distinction is critical because fixed-income households have far less flexibility when expenses rise unexpectedly. The revised plan reflects that reality more clearly than past efforts and treats financial vulnerability as an ongoing condition rather than a snapshot from a single year. Another important change centers on how relief interacts with existing monthly benefits. In earlier stimulus rounds, some recipients experienced delays or confusion when extra payments overlapped with benefit processing systems. In certain cases, benefits were temporarily paused or flagged, creating unnecessary stress. The updated structure aims to prevent this by aligning relief deposits with established payment schedules. For recipients, this means support should arrive in a familiar way, reducing disruption and uncertainty. The revised plan also acknowledges that seniors are not a single group with identical circumstances. A retiree living alone on Social Security faces different challenges than a disabled senior receiving supplemental security income, and both differ from a veteran relying on service-related benefits. The updated framework allows for these differences without forcing individuals to navigate new applications or complex paperwork. This is especially important for older adults who may struggle with digital systems or administrative processes. Cost of living adjustments remain a central issue. Annual adjustments are helpful, but they often lag behind real-world expenses. When costs rise sharply between adjustment periods, seniors are left to absorb the difference. The revised relief plan is designed to provide additional support during those gaps. It is not meant to replace existing adjustments, but to reinforce them when they fall short. This reduces the number of months where expenses consistently outpace income with no buffer. Healthcare costs have played a major role in shaping these revisions. Prescription medications, insurance premiums, and medical visits continue to take a growing share of senior budgets. Policymakers have become increasingly aware that even modest increases in healthcare expenses can push fixed-income households into financial distress. The revised framework factors healthcare-related costs more directly into how relief is distributed, recognizing that these expenses are unavoidable and often unpredictable. Housing stability is another area receiving heightened attention. Rising rents, increasing property taxes, and ongoing maintenance costs are affecting older renters and homeowners alike. Even seniors who receive regular benefits are feeling pressure in this area. The revised plan acknowledges that housing insecurity among seniors is increasing and that relief must help reduce the risk of missed payments or forced moves. Losing stable housing later in life can be especially disruptive, and preventing that outcome has become a priority. Food costs remain a persistent concern as well. While prices may fluctuate, the overall level remains higher than many seniors planned for. Nutrition is closely tied to health, and financial stress around food can lead to long-term consequences. The revised relief strategy recognizes that access to affordable food is essential, not optional, particularly for older adults managing chronic conditions. Predictability is another core principle shaping the revised plan. Seniors consistently report that uncertainty causes as much stress as financial shortfalls themselves. Not knowing when support will arrive or how long it will last makes planning nearly impossible. The updated approach emphasizes clearer timelines and consistent delivery methods, allowing recipients to budget with greater confidence. Communication has also been identified as a major weakness in earlier relief efforts. Conflicting messages, unclear explanations, and inconsistent updates created anxiety and confusion. While no system is perfect, the revised plan emphasizes better coordination between agencies so that seniors receive consistent information through official channels. This reduces the spread of rumors and misinformation during periods of financial uncertainty. The revised relief framework is also being developed alongside broader discussions about the long-term sustainability of senior benefits. While immediate support is the focus, policymakers are aware that short-term solutions must align with long-term stability. This balance is difficult to achieve, but it is guiding many of the decisions currently being made. Lessons from earlier stimulus efforts have clearly shaped the current approach. Past programs moved quickly during emergencies, which was necessary at the time. However, speed sometimes came at the expense of precision. The revised plan is more deliberate, aiming to deliver help where it is most needed without creating unintended consequences. For seniors, this means relief is increasingly treated as part of an ongoing support system, rather than a temporary fix. As this updated plan moves forward, agencies are coordinating more closely to ensure that relief payments do not interfere with eligibility for other programs. This coordination helps prevent situations where receiving assistance accidentally reduces access to essential benefits. For seniors who rely on multiple programs, this protection is especially important. The administrative burden placed on recipients is also being addressed. Seniors should not be required to repeatedly prove their need or navigate complex systems to receive help. The goal is to use existing benefit records to streamline delivery whenever possible. This reduces stress and helps ensure that assistance arrives in a timely manner. Throughout these revisions, the focus remains on dignity and stability. Financial assistance is not just about numbers. It is about the ability to meet basic needs, maintain independence, and trust that support systems will respond when conditions change. The revised plan reflects a growing awareness of these human realities. As attention turns to how payments are expected to reach seniors, continuity stands out as the guiding principle. Instead of creating a separate system, the revised approach builds directly on existing benefit channels. This reduces confusion and ensures that support arrives through familiar and trusted methods. For Social Security recipients, monthly retirement benefits serve as the foundation of eligibility. Seniors who rely primarily on these payments are recognized as facing ongoing exposure when prices rise faster than adjustments can keep pace. Relief supplements are designed to support that foundation without interrupting regular payments. For those receiving supplemental security income, vulnerability is a central consideration. Many SSI recipients live on extremely tight margins, and even small expense changes can have immediate effects. The revised plan ensures that additional relief does not jeopardize ongoing eligibility, preventing gaps that could take months to correct. Social Security disability insurance recipients are also directly addressed. Disability-related costs are often unpredictable and unavoidable. By integrating relief with existing disability payments, the revised plan aims to provide steady support during periods of increased expenses. Veterans receiving benefits through the Department of Veterans Affairs are treated as a distinct group within the framework. The revised approach ensures that relief complements service-related benefits without creating administrative conflicts, helping avoid delays or confusion. Timing remains one of the most critical elements. Late or unpredictable payments cause significant stress, even when amounts are eventually corrected. Aligning relief with established benefit schedules helps make budgeting more manageable and reduces anxiety. Households with mixed income sources are also considered. Some seniors receive Social Security alongside small pensions or part-time income. Updated eligibility rules are designed to reflect this reality without penalizing modest supplemental earnings. The revised plan also shifts how financial strain is measured. Instead of focusing only on annual income, greater weight is given to recurring monthly obligations such as housing, utilities, insurance, and healthcare. This approach provides a more accurate picture of need. Direct deposit remains the primary payment method, with added safeguards for those receiving checks by mail. Coordination with state-level programs has also been improved to prevent unintended reductions in support. Fraud prevention is addressed without creating barriers for legitimate recipients. Verification measures operate behind the scenes while keeping the process simple for seniors. Finally, the revised plan recognizes the emotional toll of financial insecurity. By emphasizing reliability, clarity, and integration with existing benefits, the updated framework aims to reduce stress and restore confidence. While no plan can eliminate every challenge, this approach represents meaningful progress toward a more stable and respectful system of support for older Americans during uncertain economic times.